Good morning, everybody. So even though I'm publishing my experience in a new phacoemulsification machine, which is the Quaterra 700 from Carl Zeiss, I have no financial interest in the presentation. So the key benefits of this particular machine, Zeiss Quaterra 700, are the main three, which I am going to elaborate today. Digitally integrated surgical workflow, the patented Quattro pump, and the automated ultrasound power on demand. The digitally integrated surgical workflow basically allows you to connect your other devices to this phaco machine so that there is efficiency in your management and a better outcome. You can integrate both IOLMaster 700 and Callisto I, and also it has a facility to actually integrate with a microscope so that you have a microscopic view of whatever the surgeon is seeing, and that helps in a better assistance by the nurse in anticipating what is coming up. By integrating with Zeiss Callisto, of course, you can have a markerless system for putting your toric lenses. You can control everything either through your intuitive user interface, which is a touchscreen, or through the foot pedal control. Then, of course, by looking into your data from the IOLMaster 700, you can have a paperless check, and there is less risk of any transcription error, as already has been pointed out by my previous speakers. Most interesting is this Quattro pump, which is patented, and the mechanism is completely different from almost all other fluid dynamics that are available. There is a synchronized fluid exchange system, and it directly measures and synchronously controls infusion and aspiration in real time. The surge control is excellent. IOP recovers in 200 milliseconds, and it is not dependent on the vacuum limit or the IOP, which is IOP level, which is set. It has a facility to real-time measure the infusion and aspiration volume, and therefore it can calculate what is the leakage from the incision, and it can compensate that leakage. If you look at the Quattro pump fluidic panel, you see there are four blue dots, which are actually inductive sensors. Two of these inductive sensors actually measure the irrigation and aspiration flow, and four pneumatic ports that controls what is the volume of the fluid which is going to go in or come out of the eye, and one irrigation pressure sensor that actually monitors the irrigation pressure and maintains the IOP. Once you go to the cassette, you can also see that there are four chambers. There are four chambers, out of which two are irrigation chambers and two are aspiration chambers. And these chambers have a membrane, and this membrane is controlled by the air coming in through the pneumatic port. The pneumatic port is connected to the pneumatic pump, which is there inside the eye. There are two pumps, and these pumps receive information from the sensors. And if there is a requirement for more fluid to go in or come out of the eye, the amount of air which is pumping into these membranes are more. Therefore, it increases the speed of the flow, and it also compensates. So if you see, this is an animated video. When one cassette or one chamber is getting filled, the other is getting emptied, and they are synchronously happening both for irrigation and aspiration, so there is no chance of any surge. And lastly, it is the automated ultrasound power and demand. So what does that mean? It helps not only to reduce the amount of ultrasound that is used, it also improves followability. The machine has an intelligent system of knowing when the phaco tip is getting occluded, and automatically the ultrasound is switched on, and the occlusion breaks, it switches off to a minimum level. So this helps the surgeon to remain more relaxed. He doesn't have to constantly press on the foot pedal to fiddle between the ultrasound and the irrigation modes, so he can remain more relaxed throughout the surgery. Before I conclude, I'll just show a video where a fairly hard cataract is being emulsified, and mind you, the flow rate is almost 90, and the vacuum is almost about 800. You can notice I did not have to make into very small fragments because the followability is good, and you can actually catch hold of the nucleus pieces without having to worry about those pieces being thrown off from the tip. And you can also see the chamber stability without any surge, how fast and smoothly the machine works and efficiently it completes emulsification. Over that, it also has integration with imaging system. So obviously, whenever you have a case of toric lens or a multifocal lens, you can utilize that facility to improve the surgical outcome. So to summarize, I would say this machine has advantages not only to improve efficiently the outcome of surgery, but also to make the surgeon more relaxed, so that if he has a long list, he would not be tense in doing surgeries. Thank you.
Thank you, Dr. Ashok, for your excellent presentation. Just like to add two things only. One thing is the surgeon who operates, that matters more than the machine. And secondly, like you showed that last case, you were not breaking much the nucleus. Even if you break in small pieces, then you can just aspirate it. You're using less of the phaco power, even that will be better option.
No, this video was made just to
I
demonstrate.
I understand.
Even if you just make 4 pieces in a hard
still you are giving a carry home message. That will break nucleus as many pieces as possible. Thank you for your excellent presentation. Thank you.